Hello, this is Jason Robertson, and I'm speaking here from a botanical garden in Seattle, Washington, on a kind of cold, dreary January day. Finally, little hints of sun, and I don't think you can see behind me, but the very first little sprinklings of spring flowers on the cherry trees behind me, but not relevant to what I'm here to talk about right now. I was asked by the cooperation schools of the AGTCM in Germany to say a few words about a couple of upcoming courses I'm going to be teaching in Germany in 2019. The first course will be an introduction and a basics course on applied channel theory. That's channel palpation and diagnosis, and that'll take place in Berlin. And then a week later, there'll be a second course in Hamburg, and that will be an advanced course with clinical rounds and case demonstrations. Both of these courses are 3-day courses and will have lots of hands-on practice with me and hopefully a couple of other senior students who studied with my teacher, Professor Wang Juyi in Beijing. The first course is the subject of this video here, and I'll say more about the second course in a second video. The first course will be a 3-day course where two main subjects will be covered. Applied channel theory, which was the clinical approach or the approach to clinical reasoning developed by my teacher, Professor Wang Juyi, you could say has two main components. One is the theory of the channels, the 6-qi transformation, the Liujing Qihua, that some of you may be familiar with from his book, Applied Channel Theory in Chinese Medicine, which is also translated into German. And a lot of that is theory, the way of understanding the body, specifically gaining an understanding of normal physiology, in contrast to a lot of the books that we see in Chinese medicine that are about pathology. So this is really an overview of, say, how the body works, especially as seen through the lens of classical texts like the Neijing and the Nanjing. And so that's one major component of applied channel theory, and that's a major part of the text that he and I worked on about a decade ago now. The second part of that text, which is the part that's harder to have in a book, is the hands-on part, the applied part, the channel palpation part. And so the first course in Berlin will have quite a bit about the theory on the first day. We'll talk about kind of an overview of the big brushstrokes of how Dr. Wang understands the body to work as a 6-channel system, kind of weaving Shanghanlun concepts, treatise on cold damage concepts, into acupuncture theory in some ways. Really, though, especially woven into Dr. Wang's own clinical vision based on 50 years that he had in practice. And so that will be the first part of the first morning, but then as we get going later that first day, and certainly the second and third day, there'll be quite a bit of time going over each of the 14 channels. That would include all the channels, the arms and legs, and the Ren and the Du vessels, one by one, talking about palpating those channels, talking about common things often found on those channels and how to evaluate them diagnostically, and of critical importance, taking lots of time to practice palpating them in exactly the way Dr. Wang did, so that students there can begin to get this feel in their hands of palpating the channels with the thumbs, the distal channels in particular, looking for interesting changes that help shape your diagnosis. So the first class will have an overview of theory and quite a bit of hands-on practice of palpation. Now, of course, the hands-on practice of palpation can't help but be separated from the idea of point location in Chinese medicine. So especially in the second class, but also in this first class, as we go through the channels, we will stop to talk about how Dr. Wang locates particular important points, a little bit about needling in this first class, but more of that in the second class, and quite a bit, though, about, by the end of the third day, we'll spend quite a bit of time talking about how to begin to integrate this palpation technique into your own clinical approach. Meaning, all right, yeah, I get maybe that you're feeling nodules in the channels, I get kind of what you're saying as we palpate here, but then how do I weave that in with pulse, with tongue, with the asking of questions, with, of course, the patient's chief complaint, to try to create effective clinical strategies. Now, really, effective clinical strategies will be fleshed out a lot more in the second class, but, and this is really an issue with many people who've been interested in Dr. Wang's work over time and have studied with me or other of Dr. Wang's apprentices, is many people are very interested in the theory, and Dr. Wang was an excellent translator of classical concepts into modern physiology and into the modern era based on his own clinical work. But a lot of people get that in their head and don't quite get the palpation part. And so for those of you interested in his work, even those of you who might have studied with me or others before, going back over the palpation is really where the meat of this stuff is. And it's so crucial, because without that, so much of the rest of what Dr. Wang says, but I think really most acupuncture, is harder to get the results that we see described by our teachers or by our texts. So this foundational class is crucial for people who haven't studied with me, but I think really would be great for those who have in the past. Some people may have questions, which we'll of course address in that class, about palpation if they've been doing it already. But really what this is going through all the channels one by one and learning how to palpate in this first class. So if you're interested in this class, that one will be in Berlin, and you can see on this website other details about where and who to contact about that. And if you're interested in this class and the second class, we'll check out the next video. Or if you've studied with me before, you may also just check out the next video for the advanced class, which will be in Hamburg. All right, thanks a lot. Look forward to seeing you guys on the in about a little over a year from right now. This is January 2017 when I'm doing this. And so, you know, as I go forward, as time passes, all of this information evolves and changes, and I'm really excited to share with you guys kind of where Dr. Wang's approach to working in the clinic is at the time I see you. Okay, thanks a lot, and feel free to contact me with any questions you have at KentuckyGinseng@yahoo.com. Okay, thanks guys, and see you soon. Bye.